Hey, this is Dr. Jason Dean with Palmer Natural Health, and I'm here with one of my favorite patients,
Yay!
Laveta, and I wanted her to tell you how she was feeling. She's been with me for a little while now. She's one of my rock star patients, but how she was feeling before she first started coming for nutrition response testing and chiropractic. How'd you feel?
I was feeling very tired. I knew something was wrong, but I did not know what it was. And now, since coming to you, I feel so much energy, and I'm actually eating and doing the right things. That's very important.
That's awesome. And I see both Laveta and her husband, actually kind of the whole family, but all of them had some issues going on, and then just nutritionally handling some issues. And then chiropractically, she was actually having a problem with her low back too, because her and her husband travel all over the country and they do a lot of driving. And she was coming in with some low back issues as well after a while. And we actually found out, we handled the problem first. So we got her spine adjusted, but then we actually found out her car was actually giving her a little bit of a problem.
Yes. And what was happening with my car, you have your car and you're thinking the little button that you push for your lumbar goes in, and that was really good for me.
Sure.
And it was not the best thing for me. Dr. Dean actually came out to my car and said that it's not working for me. So that is very, very important. And then I started feeling a whole lot better, and especially with the adjustments too.
Awesome. Now the other kicker is today Laveta came in just for a maintenance visit, and she eats really well, okay? Gets her greens in, gets her meats in, gets the things that she needs for proper nutrition. But then she went to her medical doctor just to get kind of the physical and stuff like that. And they were concerned about her bone density. So they took the bone density scan, and it came back, which we weren't worried about it here. But she came back, and your bone was good, right?
It was good. It was very good. The idea that I may have osteoporosis would be very slight.
Right.
Very, very, very slight.
Right. So they thought maybe osteoporosis for whatever reason. They got the blood work back. Everything was perfectly fine. Now, this is the kicker. They found out her blood work, everything was good, and her bone density was good. But then, show them what they gave you.
They gave me calcium.
Right.
600 milligrams.
A prescription.
And also vitamin D, calcium also.
Now, the funny part about this was I went over it with her today. I tested it with her. She didn't test for it at all. Even though her bone density was fantastic, they tried to put, these are prescription synthetic supplementation, which her body did not even test for today. And the kicker is, look at the one. It's in an orange bottle. So they're giving her a prescription-looking bottle for a synthetic chemical vitamin or mineral that she doesn't actually need. And that's what they're trying to do, is they're trying to get you to think you need the orange bottle, when in reality she didn't need it at all. She gets her greens in, she gets plenty of calcium, and her bone density scan was brilliant. Pretty happy about that?
Extremely happy. And I didn't even open up the bottles because I probably knew that they weren't good for me.
So Laveta's going to keep on kicking butt. Her and her husband are going to keep traveling. They're going to keep doing great work. They help a lot of people with their finances, but they also help people who are not making as much money and are trying to work through life and get their financial ends to work for them. So they do a lot of great work in the community, and we're just here trying to take care of them so they can keep helping us with humanity. So thanks so much, Laveta.
And thank you, Dr. Dean. Always follow Dr. Dean's orders, okay?
And I didn't tell her to say that. Have a great day. Talk to you soon.
Thank you.
Bye.